The United States, with the world's most cutting-edge medical technology and well-equipped health system, has the highest cumulative numbers of COVID-19 confirmed cases and deaths. How could it end up like this? An expert from Kenya explains the reasons behind this.
I think the two key ones that have been exposed by COVID. One is the political system. The second one is healthcare. I think the biggest problem was the way the US approached COVID, that it was highly politicized, so that the politicians and the governments in general are not able to bring their populace behind COVID in a concerted action. You'll find that most of the other countries, especially the ones that were able to do well in COVID, were the ones whose governments were able to get them behind their initiatives to protect their populations, and so they acted in a concerted effort. In the US, this divide between the Republicans and Democrats had the big governments and various political players issuing conflicting messages about COVID. So the American populace generally was left very confused with the conflicting messages, and the effect of it was that people just continued dying because they did not know how to protect themselves. The ironical thing is that US human rights activists are very vocal and very forceful, both internationally and even domestically in the US. But you hardly ever hear the same human rights activists pushing for universal health care. As a consequence, a lot of people in the US are not well covered and are dying because they cannot afford health care. It's a real paradox, because the US is the richest country in the world, yet people continue dying for lack of what is basic health care.